Next 15 minutes, again, my topic has been by Dr. Shiv Kumar is inspire or expire. Frankly, that is my motto of my life. That if I am able to inspire my younger colleagues, my job is done. Even if one surgeon gets inspired, my job is done. But if I am not able to do it, then I should expire. And our thinking is that, where are you? Can you spot this? Can you see India? Can you see Delhi? Can you see Sir Gangaram Hospital? Can you see Parveen Bhatia? No. So why have ego? Our thinking is ultimately, as surgeons, we know that as surgeons, all of us are egoists, but our thinking is that once you touch the ground and once you reach that level, that humility is there and you are able to inspire other surgeons, other people, other young surgeons, then your job is done. So our presentation is inspire or expire. And in this, all of us have seen that nothing teaches you better than this golden trio, the fears, the tears, and the years. Our thinking is life is the best teacher one can ever learn from. Many times, most of us start looking at others that they will teach us or we will be wiser. No, our thinking is the fears which we have in our mind, the tears when we shed when we are going through a bad patch, or the years, the experience, definitely they have been able to touch us. And I have divided this talk of 15 minutes into just 5 steps, and if possible. Now, first thing, when I was schooling in class 10th, in the mathematics paper, I used to write cut 1 mark if possible at the end. And my teacher was never ever able to cut 1 mark, because ultimately, can you imagine, the reason was that most of the students would touch and would check the question paper or answer paper from the top to the bottom, but I used to check from the bottom to the top. So I was very confident that if I am able to reach to the question, that means I have done my job. So cut 1 mark if possible. And in surgery also, I especially trained my younger colleagues that if you have done good lab, colleague, please tell me, is it possible to cut 1 mark or not? They say, no, it is not possible. You say, yes, that's the way. Your aim at the time of operating should be cut 1 mark if possible. So we should give our best, then only we should expect God to give us the best one. Second thing is, as surgeons, we will definitely be roaming around into the chaos. But there will be portal vein injuries, there will be CBD injuries, there will be bleedings, but it is all about finding the calm in the chaos. I know it is very, very easy to say than to practice, but once you start practicing this, that it is all about finding the calm in the chaos, and for this you have to have a balance in life, the work-life balance. If you are able to strike that balance, please do not think that you are here on earth to improve the society only, or you are going to operate on any patient, every patient, and then that is only responsibility of ours. No, our responsibility is towards our parents, towards our children, wife, and our society also, and live life to the fullest. Our thinking is that. And please remain positive. And this is my tagline onto the WhatsApp, will surprise you by my positive energy level. If you are positive in a negative situation also, I think you have done a justice. So if you are negative, there are 2 kinds of Dr. Mathur, there are 2 kinds of people. One is called as Madhu Makhi, another is called as Makhi. So Makhi will always find out the shit and sit there. Madhu Makhi will always cross the shit and find out the flower, suck the nectar, and ultimately find out and live the life. So ultimately, I always ask my especially my younger colleagues, you want to become a Makhi or you want to become a Madhu Makhi? So decide for yourself. And more important than anything else is respond but never react. This was taught to me by my professor, Dr. B.S. Rana. He was head of the department. Dr. Devarishi would remember him. So he was the HOD surgery in Maulana Azad Medical College, and he would always say, there will be n number of such situations when you can just scale through, just pass through, if you just respond. And if you start reacting at whatever message, WhatsApp message comes, you start reacting. No, this should not be this way. This should be this way. I think you are cruel to your own self rather than to others. And most important lesson which I learnt when I had taken my children to Beijing, and I was watching a martial arts show. And in this, the teacher, guru, was teaching the students that how to break the bricks with just with doing this movement. So the bricks would be broken in absolutely half of 50-50 manner. So and the lesson which was given was, a split second becomes eternal. When we are close to the CBD, then if we are distracted by the phone calls, if we are responding to the phone calls, then the chances are that we will definitely we make the patient biliary cripple. So our thinking is, a split second becomes eternal. In surgical practice, that is very, very important. And as I mentioned, just dilating on to these 5 lessons which I have learned, is that cut 1 mark if possible. And again and again, any surgery, every surgery which we are doing, we should always believe, or any work for that matter, any slide presentation for that matter, I was checking, cross-checking, and counter-checking, anytime and every time, yes, this would play today or not. So our thinking is that even if you are going through hell, keep moving, because that is the only way you will come out. And in life also, in surgery also, if we carry on moving, that only matters. And it is beautifully said, you know what life is? Move on. So if you are able to move on, and if you are intensely focused, our thinking is that yes, intensity of the focus has to be there and the consistency has to be there. We have been publishing the newsletter right from Bhatia Global Hospital and Endosurgery Institute from November 2001 onwards. And when we started our newsletter, then Dr. Adas Chaudhary, my mentor, he said that, are you ready with future editions also? I said yes, and touch wood, till date, for last 21 years, we have been publishing this newsletter every month, and that is the consistency. So our thinking is that if you are focused, if you are consistent, then only you should be able to. And how this can be achieved, especially my younger colleagues, please have a disciplined life. I get up at 4 a.m. and 5 to 6 I do weightlifting, 6 to 6:35 I do the morning walk, and then I go to Gurdwara and to Gangaram and to Global and to operate and to OPD and so on and so forth. So our thinking is that there has to be a time between waking up and getting up should be 0. So if you are carrying on tossing in the bed again and again, thinking that after 10 minutes, after snooze, you will get up, you will never be able to get up. So please make sure that as soon as you get up, please make sure that should be a 0, and suffer the pain of discipline or suffer the pain of regret. So our thinking is, please never ever quit. And this is me, this is frog inside the mouth of the stork. Many times such situation will be there, but till the last moment I am trying my best to hold the neck of the stork so that I am flying off and the stork is dead. So our thinking is that there will be n number of situations, and believe me, those failures will teach us more than the successes. So we should definitely be ready to not to give up, but to carry on moving in. And calmness is superpower. As I mentioned, that if there is a chaos, definitely there will be some situations when you will have to take charge of yourself. You will have to control yourself. And in this, and I quote this word, especially from our Prime Minister, that safar mein nikloge, dhoop to hogi hi. Our thinking is that if you started doing this, any work, there will be some challenges, but again, this is from my Zen garden, and Dr. Mathur has been to my Zen garden also. So it is all about finding the calm in the chaos. And again, remain positive. If you believe on yourself, if you remain away from negativity, and if you believe on the frog story, very small frog story, I will just narrate it and in a hurried manner because of the time. One day, the frogs announced that we are going to reach the top of the mountain. And on 15th August, say, at 7 a.m. we'll start the race. And more than the frogs, there were onlookers or the criticizers. And as soon as the race started, the frogs starting moving up, one after the another frog was falling off. And the onlookers, the criticizers were very happy. They were cheered up that, oh, छोटा सा डड्डू और सोच रहा था माउंटेन के टॉप पे पहुंचेगा. And ultimately they started discouraging. But ultimately what happened was that one frog could reach the top of the mountain. And when he could reach, the onlookers, the criticizers were very much surprised. So how could it be that all your frogs have fallen down, but only one frog has reached the top or the pinnacle of the mountain? So they started asking. And can you imagine, they coaxed the other frogs that find out, why did you fall? So any and everyone has the excuse that, oh, actually I am very, very comfortable. I am in a government job. Why should I change to private practice? I am nicely paid. Why should I go to the top of the mountain? And so many such excuses were coming. So, but they were interested in finding out why the dead frog has reached the top of the mountain. Can you imagine? They interviewed the frog. The frog carried on smiling. Why? You could guess it, because he was deaf. He was deaf to the criticism. So please, सबसे बड़ा रोग क्या कहेंगे लोग? Once you start forgetting about this, that what other people are going to say about you or your progress or your life, then obviously you are going to make a difference. So our thinking is that you should be deaf to the criticism and you should decide to be happy. Many times I have seen people going to the hill station and then saying, complaining, oh, so much of cold is there. Well, why did you come to the hill station then? Or you come to Rajasthan or and to ASIRAJ and then to go to Pushkar and you say that lot of heat, hot weather is there, lot of smell was there and so on and so forth. Why? You have decided to be happy and that's it, full stop. Once you have decided to be happy, nothing in the world should change you and that will make your life comfortable. And again, we always say, respond but never react. And live life on your own terms. This is your life that has to be spent rather than living his life or some senior's life that he wants me to live life like that. Why should I live like that? I should live my life on my own terms. Whatsoever gives me happiness, I should go in. Whatsoever is negative, I should refrain from that self. Can you imagine Buddha's story that one day, one fine morning, Buddha was spit on his face by somebody from the crowd. And what Buddha did was that he took his angocha and just wiped it off. And that person was surprised, but he went away. And he could not sleep at night, the person who had spit on him. So he came next day again to Buddha. Buddha, yes, yesterday I spit on you and you did not respond, you did not react, and you just swiped with your angocha and that's it. But I have realized in one night only that you are a great person, you are a great human being, you are just like God to us. He carried on smiling, Buddha carried on smiling. After 7 days, that person comes again. That when I spit on you, you never responded, never reacted. When I gave praises for you, you never responded, never reacted. I am surprised, I am not able to sleep at night. And Buddha says that had you come maybe 20 years back to me, then I would have reacted, I would have responded, I would have slapped you when you have spit me, and I would have given you mala or varmala when you had given me such praises. So our thinking is that go away from criticism, go away from, ultimately, this one should always learn from life. Yes, one more, this is the last lesson. So this too shall pass. If we are able to, if you have a thinking like this, if you are passing through good times, this too shall pass. If you are going through bad times, this too shall pass. And ultimately, you will be able to live a life. I was trained by Dr. J.P. Singh in RML hospital. He was Damad of Charan Singh. Can you imagine on the board behind his chair was, this too shall pass. And I think we learned this lesson right at the beginning of our postgraduate careers, and till date we have been following this. So our thinking is that please, this too shall pass, and the split second becomes eternal. And in this, again, I will just sum up with this: Bahu biti, thodi rahi, पल पल गई बिहाए, एक घड़ी के कारणे मत कलंक लग जाए. Our thinking is that when we are operating, that please start thinking that just one small injury to the CBD or to the any other structure, so that will be whole of the country will be knowing it that Dr. Bhatia was doing this and the CBD has been injured. So our thinking is that if you are careful about this aspect also, that बहुत बीती थोड़ी रही पल पल गई बिहाय एक घड़ी के कारणे, just because of one split second कहीं कलंक ना लग जाए. I think that is the spirit that one has to live on. Thank you very much. Stay flexible, stay tuned.